7 common pregnancy mistakes that increase risk of postnatal complications. Here's something they don't tell you in those prenatal classes. Over half of all pregnancy-related deaths occur within the first year after giving birth. Not during pregnancy, not during delivery, after. And according to recent research, more than a third of women experience lasting health problems after childbirth, problems that could have been prevented. Today, we're talking about 7 common pregnancy mistakes that dramatically increase your risk of postnatal complications. Some of these might surprise you, and understanding them could literally save your life. So let's get right into it. The postpartum period is far more dangerous than most people realize. The first 6 weeks after delivery are considered the most critical window, but complications can emerge up to a year after giving birth. According to health organizations worldwide, conditions like hemorrhage, hypertension, blood clots, and depression are among the most common postnatal complications. The troubling part? Many of these complications are preventable. They often result from mistakes made during pregnancy. Not intentional ones, but oversights that happen when you simply don't know what to watch for. Let's dive into the 7 most common mistakes that put new mothers at risk. Mistake number 1. Skipping or delaying prenatal care. The first and perhaps most critical mistake is inadequate prenatal care. Many women, especially those with uncomplicated pregnancies, might think they can skip appointments or wait longer between visits. But here's the reality. Prenatal care is your first line of defense against postnatal complications. During prenatal visits, healthcare providers screen for conditions like gestational diabetes, preeclampsia, and anemia, conditions that don't just disappear after delivery. Gestational diabetes, for instance, significantly increases your risk of developing type 2 diabetes later in life. Preeclampsia can evolve into postpartum preeclampsia, a dangerous condition that causes severe headaches, vision changes, and can lead to stroke. Research shows that women with hypertensive disorders during pregnancy face elevated risks well into the postpartum period. Without proper monitoring and early detection, these conditions can spiral into life-threatening emergencies. The World Health Organization emphasizes that antenatal services are essential for detecting risks early and preventing severe complications that manifest after birth. The mistake isn't just skipping appointments, it's underestimating their importance. Every ultrasound, every blood pressure check, every urine test is gathering crucial data about your body's response to pregnancy. This information doesn't just protect you during pregnancy, it creates a roadmap for your postpartum care. Mistake number 2. Ignoring pre-existing health conditions. The second mistake is failing to properly manage pre-existing health conditions before and during pregnancy. If you have chronic hypertension, diabetes, thyroid disorders, heart conditions, or even a history of anxiety and depression, pregnancy doesn't pause these conditions, it often amplifies them. Women who enter pregnancy with chronic hypertension have a significantly higher risk of developing preeclampsia, which can persist or even appear for the first time after delivery. Similarly, pre-existing diabetes requires careful management throughout pregnancy to prevent complications that extend into the postpartum period. Mental health conditions deserve special attention here. If you had anxiety or depression before pregnancy, your risk of postpartum depression and anxiety increases substantially. Studies show that postpartum depression affects 11 to 17% of new mothers, and anxiety disorders affect 9 to 24%. These aren't just baby blues that resolve in 2 weeks. They're serious medical conditions that can persist for months without treatment. The mistake isn't having these conditions, it's treating pregnancy as separate from your overall health. Your body doesn't compartmentalize. Whatever health challenges you faced before pregnancy will travel with you through pregnancy and into the postpartum period. Working with your healthcare providers to optimize these conditions before conception and maintain vigilant management throughout pregnancy significantly reduces your risk of complications after delivery. Mistake number 3. Dismissing warning signs during pregnancy. Mistake number 3 is perhaps the most dangerous, ignoring warning signs during pregnancy because you think they're just part of being pregnant. Severe headaches, vision changes, sudden swelling, shortness of breath, Chest pain or unusual abdominal pain are never just part of pregnancy. These symptoms can indicate serious conditions like preeclampsia, blood clots, or heart problems that require immediate attention. Preeclampsia alone affects millions of women globally and is responsible for approximately 50,000 maternal deaths annually. It's characterized by high blood pressure and often protein in the urine, but many women experience it through symptoms like severe headaches that don't respond to medication, seeing spots or flashing lights, or sudden swelling of the face and hands. What makes this mistake so dangerous is the window of opportunity it closes. Many of these conditions are manageable if caught early, but become life-threatening if left untreated. Blood clots, for instance, can form in the legs and travel to the lungs, causing pulmonary embolism, one of the leading causes of postpartum death. Women often hesitate to contact their healthcare providers because they don't want to be dramatic or they've been conditioned to accept discomfort as normal. But here's what you need to know. Healthcare providers would rather see you 10 times for false alarms than miss one actual emergency. Your instinct that something isn't right is valuable clinical information. Mistake number 4: inadequate nutrition and unhealthy weight management. The fourth mistake involves nutrition and weight, but not in the way you might think. Both inadequate weight gain and excessive weight gain during pregnancy increase risks of postnatal complications. Starting pregnancy at an unhealthy weight or gaining too much weight during pregnancy increases your risk of gestational diabetes, preeclampsia, stillbirth, and cesarean delivery. But restrictive dieting or inadequate nutrition is equally problematic. Iron deficiency anemia affects many pregnant women because the body needs significantly more iron than normal. Without proper nutrition and supplementation when needed, anemia can persist postpartum, leaving you feeling exhausted and weak precisely when you need your energy most. The mistake is treating pregnancy nutrition as just about the baby. What you eat and how your body processes nutrients during pregnancy affects your postpartum recovery, your energy levels, your mental health, and your long-term health outcomes. Proper nutrition supports your body's ability to heal after delivery, produce breast milk if you choose to breastfeed, and maintain the energy demands of caring for a newborn. Current guidelines recommend that women work with healthcare providers to understand healthy weight gain ranges based on their pre-pregnancy BMI. This isn't about aesthetics, it's about reducing risks of complications that extend well beyond delivery day. Mistake number 5: not planning for postpartum care. Mistake number 5 is treating pregnancy care and postpartum care as separate events rather than a continuum. Many women meticulously plan their pregnancy and delivery but give little thought to the first weeks and months after birth. Here's a sobering statistic. About 1/3 of women, primarily in lower-income countries, don't receive essential postnatal checks in the first days after birth. But even in developed countries, the gap in postpartum care is significant. The standard 6-week checkup is often the only postpartum appointment scheduled, leaving a dangerous gap when many complications emerge. Recent medical guidelines now recommend at least 4 postpartum visits within the first 6 weeks, within the first 24 hours, around day 3, between days 7 to 14, and at 6 weeks. This schedule recognizes that postpartum complications don't appear on a convenient timeline. The mistake is assuming that once you deliver, the medical oversight ends. Conditions like postpartum preeclampsia typically appear within the first week after delivery. Postpartum hemorrhage can occur days after what seemed like a normal delivery. Infections can develop from cesarean incisions or vaginal tears. Blood clots most commonly form in the first 3 weeks postpartum. Planning for postpartum care means scheduling these follow-ups before delivery, arranging for help at home so you can rest and attend appointments, and knowing the warning signs that require immediate medical attention. Mistake number 6: overlooking mental health preparation and support. The 6th mistake is underestimating the mental and emotional challenges of the postpartum period. While everyone expects physical recovery, the psychological adjustment often catches women off guard. Postpartum depression is not the same as the baby blues. Baby blues are mild mood fluctuations that typically resolve within 2 weeks. Postpartum depression involves persistent sadness, hopelessness, anxiety, difficulty bonding with the baby, and sometimes thoughts of harming yourself or the baby. It's a medical condition that requires treatment, yet many women suffer in silence because they feel ashamed or believe they should be able to handle it on their own. Recent research identifying anxiety, depression, and obsessive-compulsive disorder as among the most common postpartum complications should tell us something. We're not preparing women adequately for the mental health challenges of this period. Risk factors include a history of depression or anxiety, lack of social support, a traumatic birth experience, and major life stressors. The mistake is treating mental health as separate from physical health during pregnancy and postpartum. Your brain is an organ that undergoes significant changes during pregnancy and after delivery. Hormone fluctuations, sleep deprivation, physical pain, and the enormous life transition of becoming a parent all impact mental health. Preparing means discussing mental health with your provider during pregnancy, identifying your support system, learning the warning signs of postpartum depression and anxiety, and removing the stigma from seeking help. Mistake number 7. Not advocating for yourself. The 7th and final mistake is perhaps the most insidious, not advocating for yourself when something feels wrong. Studies show that women's concerns are often dismissed or minimized in healthcare settings, particularly women of color, who face significantly higher rates of maternal mortality and morbidity. You know your body better than anyone else. If you feel that something isn't right, whether it's pain that seems excessive, bleeding that seems heavy, exhaustion that feels debilitating, or sadness that feels overwhelming, that's important information. The mistake is accepting dismissal when your instinct tells you something is wrong. Black women are almost twice as likely as white women to experience serious postpartum complications. Native American women face even higher risks. These disparities exist partly because of systemic racism in healthcare, but they're exacerbated when women don't feel empowered to insist on being heard. If your provider dismisses your concerns, but you don't feel right, seek a second opinion or go to an emergency room. Many serious postpartum complications, blood clots, infections, preeclampsia, have symptoms that can be mistaken for normal postpartum discomfort. The difference between a manageable complication and a life-threatening emergency can be a matter of hours. Wrapping it all up. So, there you have it. The postpartum period is not just about the baby, it's about the mother's health and survival too. The 7 mistakes we've covered today, skipping prenatal care, ignoring pre-existing conditions, dismissing warning signs, poor nutrition and weight management, not planning for postpartum care, overlooking mental health, and failing to advocate for yourself are all preventable. Understanding these risks doesn't mean living in fear. It means being informed, being proactive, and being prepared. The first year after childbirth is indeed a vulnerable time, but with proper care, most women navigate it safely. The key is recognizing that pregnancy, delivery, and the postpartum period are all part of one continuous journey that requires consistent medical oversight and self-advocacy. Remember, asking questions doesn't make you difficult. Seeking help doesn't make you weak. Taking care of yourself isn't selfish, it's essential, because your baby needs you, and that means you need to be healthy, both physically and mentally, not just during pregnancy, but long after delivery day. If you're pregnant or planning to become pregnant, share this information with your healthcare provider. Use it as a starting point for conversations about your specific risk factors and how to minimize them. And if you're in the postpartum period and something doesn't feel right, don't wait. Reach out for help today. Your health matters, and recognizing these common mistakes is the first step toward a healthier postpartum experience. If you found this video helpful, please give it a thumbs up and subscribe for more health content that could make a real difference in your life. Drop a comment below if you have questions or want to share your own experiences. And don't forget to share this with any expectant or new moms in your life. It could literally save someone's life. Thanks for watching, and I'll see you in the next video.